You might be wondering how to use Nutranize when you're only on prednisone for short bursts of time. So I had a prednisone warrior ask if I only use prednisone when I'm doing a prednisone burst to get through an exacerbation, either 5-day or 14-day burst. My question that I'm wondering is, once I continue or complete the prednisone burst, should I continue using it, and for how long? Does it help recover having used prednisone and any of the side effects that may linger after completing it? And then he says he tries to keep a couple of bottles on hand just in case he needs to do a round of prednisone. So basically, how to use it when you're only doing prednisone bursts for short periods of time, and whether to continue to use it in between prednisone bursts. So that is a fantastic question because Nutranize is designed to do something simple, it seems, and that's replenish the nutrients that prednisone steals. We know that lots of the side effects of prednisone are directly from nutrient depletion. Osteoporosis is because of calcium and vitamin D being depleted. The diabetes and the high blood sugar can be from the chromium depletion. So if we give back those nutrients, then we don't have the side effects, right? So that's the main purpose of Nutranize. But I didn't stop there when I created Nutranize. I actually went one step further. And instead of just replenishing the depleted nutrients, it also helps to counteract other side effects. Now, what does this have to do with short-term prednisone or bursts, or do I take it after I stop taking prednisone to help me recover? Because some of those side effects aren't simply nutrient depletion. For example, prednisone is an immunosuppressant. It's causing your immune system to go lower. And even after your last dose of prednisone, your immune system doesn't recover for at least 14, if not 21 days or longer. And so we want to support your immune system in that recovery period. And so continuing to take Nutranize for at least 3 weeks after your last dose of prednisone makes a lot of sense. And that's just for your immune system alone. Then there's other things like your blood sugars. So prednisone is a glucocorticoid. That means it's helping with glucose or sugar, and it's changing the way your body's using it, leading a 2 times higher risk of diabetes and hyperglycemia and all of these complications. And just because you stop taking prednisone doesn't mean your body automatically gets back into gear and is regulating glucose properly anymore, like immediately. And so if you continue taking Nutranize, then you've got the berberine, the chromium, the vitamin D, the cassia bark cinnamon. Those are all helping to support healthy blood sugars. And what's really cool is when you have a stable immune system, when you have stable blood sugars, you actually probably may be lowering your risk for needing prednisone in the future, because high blood sugar leads to inflammation, and that's what's needing why you are often needing prednisone is because it's an anti-inflammatory. So if we can get your blood sugar stable, if we can get your immune system stable, if we can get your body systems in a way that they're not going high and low and out of balance, if we can keep them in balance, that's awesome. And so you can continue taking Nutranize in between your burst doses, and maybe you'll need less prednisone. Maybe you'll need prednisone less often because you're supporting all of those systems with what they need to be stable and continually supported. So if you need prednisone here and there, you can take Nutranize for at least 3 weeks after, and maybe continuously. You don't have to stop taking it just because you stop taking prednisone. In fact, Nutranize is designed to be supportive to anybody, even though it's designed specifically for the needs of people on prednisone. Any adult could use it safely, for the most part, unless there's very rare situations like kidney transplants or really rare situations. But for the most part, Nutranize is designed to support general health as well. And so anyone could take it, even if they've never taken prednisone at all. So the main answer here is yes, continuing to take Nutranize after you stop taking prednisone will support you. It will help you to recover from what prednisone has been doing to you. And it may even help you so you won't need as much prednisone in the future. Can't guarantee that because that's totally dependent on your health and your condition and so many other things. But in general, keeping inflammation lower can help you to not need as much anti-inflammatory. So that should help you answer the question of how to use Nutranize when you're only doing prednisone bursts for short periods of time, and whether to continue to use it between prednisone bursts. If you have other questions about how long or how much to take of Nutranize in between prednisone, please let me know, reply, comment below, and I can answer more questions for you. Signing off as Dr. Megan, your prednisone pharmacist.